Cheers. Nak revise saja ni dah semalam. Ha? Integrate. Explain that you want to examine the ear. Verbal consent. Next, mana dulu? Inspection. Walaupun orang cakap right ear, you have to inspect both ears. So you stand in front of the patient and then I can see both ears are normally located. How do you know whether it's normal located?
Eye level.
Huh? Eye level? Pina dia superior pina is about the upper border of the eyebrow lah. Kurang. Boleh? Okay, betul eh? Sengit sikit pun tak. Unless it's here. What do you call that? The ear is here. Low set ear in what condition? Down syndrome. Banyak lah. Bagi peluang dia cakap. Alright, we will get the time, okay? Down syndrome, ha? Ataupun tak ada telinga. You dah tahu. Tak ada telinga. Atau telinga kecil aja. You pernah tengok tak ada macam skin tag ke whatever? Ada telinga. Ada tag aja. Apa? Telinga kecil lah. Microtia, very good. Microtia, okay? Tak ada lubang telinga? Tak tahulah, saya pun tahu. Okay, no, there's a name for that. Iconia. Iconia tu is a tablet. Iconia. Never mind, it's okay. So you have to explain by inspection, right? So you check inspection, then you go straight. This is normally located, alright? And then you divide the ear into 3 parts. This is the easiest way to do it. Pre-auricular, pinna, and auricular, post-auricular. Pre-auricular, auricular, and post-auricular. Understand? You tengok dekat pre-auricular area, apa. Tengok sini lah, tengok sini. Dia ada 2 telinga. Dia main tengok sini. Pre-auricular and pre-auricular area, you tengok for swelling, you tengok for any scar, surgical scar, ada dekat sini. Alright? You tengok for any redness and also any lubang. What do you call that lubang? Sinus of the neck. Sinus. Apa dia sini? Kita tengok dekat pre-auricular. Jangan karu telinga dia. Pre-auricular sinus. Pre-auricular sinus. Dia ada lubang kat sini. Kan setengah-setengah your friends ada kan? Si patut kat sini ada. Mana? Ada? Kat situ ada. Kawan saya. Oh, kawan saya ada. Kat sini ke? Kalau ada siapa mengaku ada. Lubang tu kalau pendek, kalau cetek tak ada masalah. Ni yang dalam yang ada banyak chamber. You understand lah. Rumah dia ada bilik dapur, ada semua ada. So this one kadang-kadang dia kulit dia apa? Dia get infected and then dia get swelling and then bengkak kat sini. So you have to be wary of it. Okay, pre-auricular. Auricular pula any apa tu panggil ni? Piercing. Dia piercing lobe labur Sarawak Iban Iban yang gantung macam-macam tu. iPod pun ada, iPhone pun ada. Alright. All these things, abnormal structure of the pinna. Then you go to inspection. This is the part where you can touch the patient during inspection. You just cakap, maaf ya, nak tengok belakang telinga. Then you go did like this, and then you see any scar. There's a scar here, surgical scar for mastodectomy, and also you flick the hairline like this, macam our friend who is holding the camera now. And you flick the hairline like this to look for the scar. Contoh dia. You were late just now. I thought to take you, tak apa, never mind. There's a scar there. Alright? Check. This is the time you check. Professional, nampak professional kan? See. Maaf saya tutup sikit nampak. Tengok. Maaf ya. Saya ni sikit, tengok sikit. Then done. Alright? Nampak professional kan ni? Alright. Then okay. Fair kan? Kita alih mula kan? Okay. Alright. So again tengok macam ni. Okay, done. So what else? After that, yes. Palpation. How to palpate the ear? Now, I turn this way first. Okay. Again, divide into 3 parts. Then use either thumb or your index finger. No other finger. Understand? This one no. Okay, thumb on this. I use thumb first and you press here. Professional. Professional. Hold the other side of the head and then counteract. Okay. See, palpate kat sini ataupun use your index finger palpate. See any swelling, any tenderness. Kalau sakit kat sini, if there is tenderness when you palpate at the preauricular area, listen to my question. Where is the most likely pathology? Where is the most likely pathology?
Canal.
Canal of what? Sebut habis, saya sebut benda lain. Canal of what? Complete your answer. As a medical student, this is a mistake. You always want us to complete your answer. We'll never do it in exam. What canal?
External ear canal.
External ear canal.
Very good. Complete your answer. External ear canal, sir. Good. Alright. Kalau sakit kat sini, maksudnya pathology dekat external ear canal. Then you palpate gently. Then you grab the pinna and you palpate gently. Wait, don't worry. This is the other ear. Palpate gently like this. Okay? Palpate like this, gently. Don't pull the ear. Siapa yang sini tak sakit kalau tarik telinga dia? Sakit, tarik telinga sakit. So you palpate gently. Alright? Feel should be firm, right? See, look, flat. Dia magic, look. Ting. You understand? Look again, Ting. Should be like that. Dah. Ambil apa? Bag, ambil bag dia. Bag dia. Wah, bag rabbit tu. Yeah, neneng. Okay. Yeah, rabbit. Alright. So, I trick for you. Siapa buat pediatric posting already? Then you know the trick, right? Premature baby. If you do this like here, it will not come back like this. You tak tahu? Oh, I'm teaching you anything. Oh, good. Premature baby, nak tahu dia premature tak? You lipat telinga dia and it will stay like that. You understand or not? That's premature lah. Kalau you lipat macam ni and it will go like that, it's okay. Mature. Alright? Good. Then post-auricular, the same thing. You palpate. Professional, nampak palpate macam ni. Okay? Like this. Palpate like this. Alright? Feel for any pain. If you have pain at the post-auricular area, where is the most likely pathology? External ear canal. Mastoid SL or? Pass. Ear is divided into how many parts? 3. Middle ear. Middle ear pathology, okay? Most likely, I say most likely, not all. Most likely. Good, done, palpation. Done palpation. Next, what you want to do? Huh? Yes. Karam semua dia. Kenapa you nak tunjuk kertas juga? Oh, by the way, dalam exam, I know this is see, I have also this non-verbal communication thing, going like this. Dalam exam, try to control yourself not to do this, right? I would like to examine the tonsil and the neck and the ear. Why you have to do this? Hey, I want to do the tonsil, the neck and the ear. It's okay. Imagine when you say, I would like to do examination of the breast or testicular. You want to show that? No. So put your hand down. Alright, see. How do you hold the otoscope professionally? If you hold like this, that means that you have been through the ENT posting. This is not the way to do it. Okay, I don't care. Alright, dia kata selesa macam ni ke tak? But this is how you do it. Hold like a pen. I know some people who pen macam ni. But this is the way you hold the pen, right? Macam Idayu. Idayu mana Idayu? Mas Idayu pegang. Oh, dia macam ni. Okay, this is how you. Alright, this is how you hold it. Alright, right hand, right ear. Yeah. Sama-sama. 2 minggu. Bye-bye, Kalisha. Bye-bye. Oh, yeah. Alright. So, open up the light. Nak cuba buka lampu pun. This is very press for the light. Green, press down to twist. Understand? Ini, I can see everything. Lampu pun tak nyala. Green pula. Red. Oh, how come it's red? Okay, it's usually green. Lampu tak berapa terang. Never mind, it's okay. This is it. Okay. Now hold. There's 3 steps. Okay. Now you sengitkan kepala dia, whatever you want to do. Angle yourself. Then you snuggle this thing nicely in the ear. Alright. Don't move. You go into the eyepiece and have a look. Tengok. Tak nampak. Then you move the pinna. Still tak nampak. Then lastly you move this one. See? Kalau you move this one earlier, dia dah bergerak dah. You understand tak? So you go like this. Tengok. Tak nampak. Then you move. Tak nampak. Then you move this. You understand? That's how you do it. Don't go and like that terus. Okay? Why I always like with my 2 finger like this? Support this. Because kadang-kadang your member kata, "Oi, tepuk belakang. Mana pen saya?" Oh, belakang ini. Terus ni nampak nama Yuazim. I can see Yuazim there. Yuazim, betul kan? Nampak kan? I can see Yuazim. I don't know. Tembus, Alright. Again, gaya, mutu dan keunggulan. How you act. You know, you just... Saya mau periksa telinga. Okay, then you go in like that. I give you 5 marks only. The thing you're supposed to see, then you have to describe, then you like it. Okay, now what you're supposed to see? You walaupun pegang tu, you have to. What are you supposed to see? You divide what? How do you want to go? Anterior.
From external to internal.
Good. External.
From the skin on the
Okay,
external
external and
wall.
to the inside. Good. Next, what do you want to see?
Tympanic membrane.
Oh,
The external.
External first.
They find any deformity, any narrowing.
Good. Patency of the canal. Good. Next. 5 ada. Yes, patency. Next.
Any discharge.
Good. Cooling of discharge. Good. Next.
The walls. Walls of the canal.
What happened for the wall? What? Swelling. Good. Swelling of the canal, whatever. Okay, I can accept that. Next.
Earwax.
Foreign body or mass in the ear. Earwax is part of it. Don't be so amazed about earwax. Dalam exam selalu macam ni, lupa nak jawab. Go inside, wow, man, so golden color, juicy, dripping all over wax. Tak payah, just you say wax. The wax is normal. You only talk about the wax if it is obscuring your view to the TM. That's all. You say, I can see, sorry to say, the wax is obscuring my view. That's all. Or it is impacted wax. It's full of wax. That's all. Don't say face on the right upper corner, 9 o'clock, 10 o'clock. The floor a bit slippery. No. Don't be amazed by wax. Okay? Stop there. Next.
Any sinus and the external.
Come again? No, inside the ear canal. Sinus.
Breathe.
Yeah, okay. Skin I accept. No, sinus is what? It's good. It's good because there is 2 opening directly there. In the ear canal. What? You don't know, right? To the parotid. Okay, never mind. Never mind, it's okay. It's okay. But you are digging your own grave, man. Okay. Next. What else?
Got any foreign body?
Good, done. Okay, so 5 kan? Dah 5. No, patency, skin color, mass or foreign body, swelling, and discharge. Alright, cool. Then TM. Normal TM looks like what? Give me 5 characters of normal TM. Say normal say the first one, whether it's present or not. Say
Whether the membrane is present or not?
intact, intermediate memory. Good. Next. Color is what? Pink color? No. What color? Translucent. It's translucent. Okay, next. The color depends on whatever inside the middle ear. If it's when it's blood, it's red. When it's blood, red or blue. When it's pus, it's yellow or green. Understand? When it's fully, normal is just translucent and then it looks like white lah. Okay, let's say white now. Next. Huh?
Cones of light.
What?
Cones of light.
Cone of light. Cone of light. Okay. Cone of light means there is a normal TM. What you have to say is, I can see a light reflects and it is cone in shape. Maknanya ada light reflex, it is normal. Or you can say, I can see light reflex, but it is dispersed. It's dispersed, scattered. That means that it's a normal TM, whether it's retracted or it's bulging. Okay, next. Good, any perforation. Next. Ada cukup 5. Any normal structure that you can see on TM. And I can see normal structure on TM such as pass. Good. Handle of malleus, ambo. Alright. Okay, good. Usually I will not give you a normal ear. Ini soalan bocor ni. I will give you a soalan bocor. A perforated ear. A perforated here. Wahin. Wahin. Because why? Because the pen is in between the S. So I can wahin. Okay, never mind. Okay. I usually give a perforation. This is normal. Perforated ear. So what do you want to comment?
The location.
The location, excellent. The location of the perforation. You can divide the TM into into 4 quadrants. Okay. You divide along the handle of malleus angle, bukan dia straight macam tu, right? Okay. Next, you can still divide into
Marginal or central.
location. Good, marginal or center. You can also divide into no, location lah. Jangan jawab slow je. Pass. Oh, pass. The TM is divided into 2. I know, superior is called
Extensa pars flaccida.
pars flaccida and extensa. Also, you can see, you say the perforation is located at the pars tensa at this area, or pars flaccida. Understand or not? Or the attic. Okay, next. Look, don't finish my question done. Size. You have to put your finger macam Harry Potter je. Size. How do you ukur the size? Bring in the pembaris. How do you ukur the size? Percentage? Good. Percentage compare to the normal size. Okay. Medical student punya answer. Listen. It's either below 50%, above 50%. That's all. You understand? Postgrad punya answer 20%, 30%, whatever they want to say. Medical punya 50%. Cut off point upper or lower. Next. Very good. Discharge. Discharge tells you what? There's perforation, 50%, and also discharge. Maknanya? It's active. Active infection. Next. No, means that there's perforation or no perforation. Next. This. Pass already answered. Pass, discharge. Come on, Rahman. Good, good. Yes, the age of the perforation. Yes. Regular or irregular. This will decide whether the teacher, the husband, the mother, the parents gonna get sued. You decide. You see, there's a perforation and it is jagged. I believe this is a traumatic perforation. Then the teacher will get sued. You understand or not? You understand or not? Dia infective punya perforation is rounded. Very nice. Traumatic is jagged. Macam koyak kan? Koyak kain tu. Jagged. Alright? Cukup dah 5. One more. Yes, one more. Tak tahu, tak apa. Anything that you can see beyond the perforation. Beyond the perforation. You understand? Polyp, foreign body, pus in the middle ear. So 5? 5? Is it 5? Salin semua salin. Whatever. Pick up from your friends. Okay? Good. What next? What next? Come. Pass. What next?
24.
No, okay. You just say, I would like to do a clinical hearing assessment. Say clinical hearing assessment. Clinical hearing assessment is divided into how many parts? Two parts. Two parts. One is the tuning fork test. Another one is a
Voice test.
tuning fork test. Another one is a
Voice test.
free field voice test. Field voice test. Because you are doing this here, then you can see the staffness talking, stomach is grumbling, fan is moving, whatever. It's a free field voice test. It's not a soundproof test. Okay, tuning fork test. Tuning fork. Okay, come. Vamos. Vamos, amigo. Okay, this is a tuning fork test. Okay, let me introduce you to tuning fork test. This is the base. This is where you put on the. You don't put like this. Alright, this is the handle. This is where you hold this. You don't hold here. Okay, you hold here. This is the flange or the fork or whatever you want to say. Okay, this is where the vibrating part is. Right, it's not here the vibrating part. It's here. Alright. So first, Rini. How do you want to do Rini? Yes. Put your hand down. Cuba cakap dekat kasi ada frostbite. Amir cakap dia. Macam mana nak buat Rini? You tak tahu cakap tak tahu, tak apa. It's okay. Tell him.
Cakap cara ke explain?
Explain lah, nak buat lah macam you nak buat sekarang. Oh.
Saya ketuk, letak.
Okay, let me explain. Okay, there's a simple way to do it. Okay, listen. You do this, okay? Okay. Pakcik Amir, saya nak periksa pendengaran Pakcik Amir menggunakan alat ni. Okay, saya akan bunyikan alat ini. Okay, don't say saya akan ketuk ke, saya akan whatever. Because patient takut, nak ketuk pada saya. No, saya akan bunyikan alat ni dan saya akan periksa telinga pakcik. Okay? Okay. Now, you hold like this and you vibrate using only two parts of your body. Alright? Only your elbow or the knee. That's all. Don't do anything else. Your elbow and your knee. Bukan kata, cik. Jangan pernah pandai buat gitu. Or, even worse, examiner, prof. Mati. Alright, so how do you do? Don't flick. Oh, konon-kononnya style lah. No, or this one. Exam ada dalam tu. I don't know why your senior box ni wrong. So this I did this. Ketuk slow saja. Very slow. Look. Bunyi ah? Bunyi? No, but it's vibrating. Look. Tak dengar, tak tahu. Yeah, it's vibrating. Still, I can still walk around with this thing vibrating. Tak payah tanya dulu. Alright, so tak payah kuat-kuat. Ni ketuk. Bunyi. You ketuk ni, dia ni vibrate. No, you ketuk sikit je. Yes. Small. Tak bunyi pun, but it's vibrating. Good. Now you ketuk. Then this one is a modified Rini. There's a true Rini and modified Rini. Modified Rini you put at the base, belakang. Stop. And then pakcik tanya, Pakcik boleh bunyi dengar ke? Dengar ya? Okay. Yang ni kuat tak? So you compare posterior and anterior. Okay, bone and air conduction. Betul? Okay, the true one is you ask the patient to either you want to start here or here, it's okay lah. Pakcik dengar ya? Kalau tak dengar, cakap. Dengar lagi? Dengar lagi? Lambat kan? Dalam exam, you use the modified one. Dengar lagi? See, can hear. Very good ear. So then you change. Dengar? Okay. So there's a true rini. True rini is longer, but modified rini is easier. Understand? So do rini. How you hold this? How you press? Okay, listen. Depan sikit. Here you press. You put here. Okay. There's 3 ways to press. You press firmly. Firm. Firm means firm. You put professional sikit. Letak tangan kat dalam. Firm. Not hard. Alright. Or not soft. You know soft? you if you do macam tu tak rasa, patient takut. Alright, you just firm. Maknanya dia kemas, relax, dia vibrate nicely. Too hard, vibrate and you also vibrate. And then patient just soft and nothing lah. Alright, so buat macam tu. Then when you put at the air conduction part, you put like this. Okay? You put like this. Like this. Not like this. Not like this.
Vibration.
Huh? Not like this, of course. Not like this. Not like Harry Potter. This. Boleh? Okay? So vibrate. That's rini. Interpretation of rini, read in the books. You will have a class on it. Okay, now Weber.
The one we use is 256, is it?
Oh no, 512.
Oh.
The best is 512. Alright, there's a lot of. There's 256. There's 125. Alright,
128.
no,
128.
128. Alright. So again, this is how you do rinis. Boleh? Can you do this? Yes.
Doctor, you need to move around to the left side.
Yeah, you move. You can move. You can move. Hand, you can change hand, whatever you. But the professional look, you have to have. Jangan buat macam ni. Professional lah kan, relax. Di sini nampak professional senyum, ambil gambar banyak. Professional. Okay. Weber. Now Weber. Weber is in where?
Forehead.
Again, pakcik saya akan getarkan benda ni. Saya akan letak di sini, tengah ni. Pakcik cakap yang mana lebih kuat bunyi. Yang mana bunyi. Okay. Sekali lagi you knock. You do this. I usually do this. Okay. Then you put it here. Alright. Bunyi sebelah mana? Tak bunyi. Bunyi sebelah mana? Tak bunyi. It's okay. It's equal. Alright. Tak bunyi tak apa. It's equal. But patient tends to hear from this side, then you have a pathology. Understand? Now, where did I stop? Here. Oh. Okay. You know a sing. You pernah jumpa sing? Sing, right? Of course, yeah. Punjabi sing. With a turban. Alright. Where do you want to put now?
Forehead.
Here, forehead. You want to put here? Forehead, ah? Ada jerawat kat sini. Main orang pun. Hey. Sing. Ranggut dalam sini. Main orang pun. No, ada turban. Main orang pun. No, there's a turban. You tak pernah tengok sing. Main orang pun. Main orang pun. Sini, ada jerawat kat sini. Masa?
Warmy part of the nose.
Main orang. Gigi?
Tip of the nose.
Gigi? Gigi tak ada gigi. Sini misai tebal.
Here.
Hidung ada jerawat. Ada jerawat, hidung dia crooked. Hidung dia this side.
Occipital.
Ni. Ada turban.
Tapi avoid the
Okay, it's a bone conduction test. So where is the bone on the head? Everywhere, right? So you can put anywhere you want. You understand or not? Not only midline. Alright? The point is, I'm saying that bukan midline sahaja. You can put either where, anywhere you want. But if you put this side, patient tends to hear from this side. Bias. So that's why you put midline. Understand? Alright? Remember the sing. Jerawat, janggut, this side. Okay? No midline. Okay? But ideally you put midline lah. Okay. Weber. Done. Next is voice test. Practice this. I will know anyone who tak pegang benda tu. They will have the, they pegang salah, whatever. You have to practice this. Okay? Now, voice test is just checking the hearing with your voice. Alright? before you talk, you have to know what level your voice is. Berapa decibel. Sometimes your whisper is sama dengan dia punya shout. You know, you don't know, right? So, and then you have to check the patient punya tu. Pakcik saya akan uji buat test untuk pendengaran pakcik menggunakan suara saya. Okay, saya akan sebut beberapa number dengan huruf, pakcik ulang balik. You have to explain like that. Okay. First you test the patient punya tu. 35A. Sebut 35A.
35A.
78C.
78C.
Bagus. Okay, itu macam tu saya. Okay. Now you test this ear. Alright. What you do is you stand on the side of the ear you want to test. Use this hand, slap the patient. No, use this hand, block the patient punya eye. Like this. Like this. Okay? Don't block like this. Dia bau belacan you makan. Like this. Alright? Use this other hand, press on the tragus and push in using your middle finger. Alright? Middle finger, push in, and then rub your middle finger like this. Alright? Nanti dulu, nanti saya pergi sana. Okay? This is masking. You are masking this ear. Alright? Rub this ear. And then you arm length. You cakap 75A,
Ulang.
75A.
38C,
38C.
28A, sebanyak 5 kali. Conversation level first. Then you go whisper. Dia boleh dengar semua kan? 73A.
73A.
You janganlah whisper. Sebut macam biasa lah. Whisper balik. Let's say patient tak boleh dengar conversation. Patient tak dengar conversation. 78A dia tak dengar apa semua kan. Then you shout. Shout. Then you shout. Jangan shout. Shout macam ni. Shout sama arm length. You understand tak? Okay, let me show you this side. Okay. Whisper juga. Alright, so again, this hand put here. This hand rub. Jangan letak jari you dalam lubang telinga dia. You will see something in your finger. Alright, you press on the tragus and press like this. Okay, some people do like this. Alright, but I don't like this because sakit. So I do this. Okay, 78A,
38A.
38C,
38C. 78A. 85B.
Okay, alright. So you sebut 5 kali. Dia kalau boleh dia lebih 3 kali pun okey. Kalau 5 kali bagus. But you have to check your conversation level. Then you know where the level, and then you kata kalau tak dengar whisper, kalau tak dengar conversation, only can know whisper, that means that you know that the decibel is just about this area. Confirm balik dengan PTA. What is PTA?
Pure.
What is PTA? Pure tone audio metry. Very good. Okay, done.
So after we do this, how to comment to the examiner?
Dia kata this patient has a normal hearing via the voice test because patient can hear my conversation level voice and also my whisper. You understand? Or you say there is some hearing problem or hearing reduction because patient can only hear my shouts. And then you have to tell them, and then I think the decibel for this patient is about let's say 30, 40 bawah lah. It's very subjective because it depends on your voice. Your shout macam mana? Sama dengan her whisper. So macam mana bayangkan dia shout macam mana? Prof Din dah jumpa? Belum. Suruh Prof Din shout. What posting are you in? ENT. I would like to complete the ENT examination. I give you an option. What examination you want to do? Very good. Facial nerve examination, because the facial nerve comes out from the preauricular area, right? It comes out here, it goes here. Ingat tak facial nerve tu? Apa? Ni?
2 zebra bite my
5 kan? Ada apa dia akronim dia?
temple. 2 zebra bite my car.
10 to whatever. 2 zebra bites
My car.
my car, whatever. So remember that. So you have to examine facial nerve. How do you do facial nerve examination? Quick one. Behind you. How do you do facial nerve examination? Quick one. Come. Pass already. Oh, alamak, pass. Smile. Show teeth. Lagi next.
Wrinkle the forehead.
Wrinkle the forehead. How you wrinkle forehead?
Siap buat.
No. How, okay, good. How you wrinkle? Yes, you show me. I'll ask him to wrinkle. Tengok atas. Tengok atas.
Kerutkan dahi.
Kerutkan dahi dulu. If they cannot kerutkan dahi, then you ask. Okay, tengok jari saya. Tengok ikut jari saya. Ikut. There you see that wrinkle. You understand or not? Jangan tengok atas. Tengok atas dia buat macam ni. Alright. Okay, don't move your head and follow my finger. That's how. Next.
Any facial symmetry.
Good. Station level 4 and little next. Dah payah tunjuk. Put down your hand. Blowing nak. What? Blowing the cheek.
Cheek.
Blow up the cheek. Blow up the cheek. Okay, next. Dah cukup. Next level lagi.
Entire open.
Close the mouth and try to open.
Close the mouth. Try to open the mouth.
Close the eye.
Dengar tak suara-suara tadi? Dengar. Close the eye and ask to open eye. Okay, you can do like this. Tutup mata rapat-rapat. Jangan bagi saya buka ya. You can do like this. One hand and use one hand. Don't never do like this. Never do like this. Dia cakap, oh doktor makan nasi belacan mana? Okay, don't do like this. Do like this and do like this. Okay, next. Patient have done. What else you want to do? Open the door then. Thanks the patient. Close the door. Good. Done. So that's your pathology examination. Boleh. Common things that you want to know about pathology is disease of ear is what? What is the function of ear? Hearing and balance. So hearing, you have to know your 5 conductive hearing loss. Causes of conductive hearing loss. Contoh. Give me one. Tak apa, then you go back and list out the common one. Alright? Foreign body, whatever. Okay? Common sensory neuro hearing loss. Okay? Infection of the ear. Give me one. Give me infection of the ear. One. Otitis media. Infection of the media. Otitis external. Infection of the infection of the ear.
CSOM. CSOM.
Otalgia is pain.